Hello, everybody. Welcome back to another episode of the Ramos Law Difference Makers podcast. I'm Dr. Jim Hoven, and it is my absolute pleasure to be visiting with people who are making a difference. And it could be in any number of topics. If you've listened to the show long enough, you know that we've had celebrities and we've had team members here, and we've had clients of ours, and we've had people that own businesses. Today, hold on to your hats, because this guy has made a difference in lives around the world. And he happens to be a dear friend of mine, a brother. We've had a business together. I mean, this guy, I couldn't wait. I think I've been practicing for over 70 episodes for this one right here. So you guys are going to have an incredible visit with the one and only Dr. Steve Capobianco. Capo, welcome to the show, man. So glad to have you.
Thank you very much. What a great intro, and a little bit of pressure, I have to admit, that you placed on me. But listen, if we're talking about how we can make a difference, it's something that you and I have talked about for many years, and I'm more than honored to be able to have the opportunity to talk to you about what I think can make a difference.
Well, you have done so much for me. I got asked to be on a show. I'll start off with this. I got asked to be on Dave Cruz's show for his web exercises thing, and I'm doing that in a couple of weeks here. And they had asked me, you've had your license for 30 years. We would love to hear what it seems like if you've been in practice 30 years. And so realizing, I first built the whole talk a few weeks back, and then I realized that it's not just chiropractors on the talk, right? It's chiropractors and physical therapists and movement therapists, all these people. And so as I'm putting together the talk, one of the pivot points that the realizations that hit me, Steve, was that one of the biggest turning points in my career, this was before I had left full-time practice, it was the concept of proprioception, mechanoreception, movement as a medicine, outside of the chiropractic adjustment, and just the power of these things. And that all came from the training that you devised at RockTape. So first of all, thank you for that. I know you've been spreading that message around the world, literally to different providers, making a difference. But as we get started in this, would you just tell us a little bit about your journey, how you've come up from, lacrosse and hockey player as an athlete up to then a doctor of chiropractic, and then even running and being the medical director for a tape company and all the great things that you've done. Just love to get a little background.
Yeah, well, thanks for the opportunity to kind of share some of my history. It's always interesting to start to think back of, what molded you and who molded you and all the experiences that kind of put you in the position that you're in. And so I guess I could start with, I was born and raised in Canada. I had the opportunity, it was basically force-fed in Canada, which was you're going to play hockey and lacrosse. And so those are the sports that I played the majority of my life. And, and dealing with injuries that I've dealt with those types of collision sports, I kind of got thrust into the experience of working with multiple different therapists throughout my playing career. And once I came to that realization that I wasn't going to be a professional hockey nor lacrosse player, I decided to go into my educational experience was going to be revolving around how to help athletes was what my ultimate goal was, but obviously that's evolved into helping everyone that I can speak to. So I did an undergrad in kinesiology. I did a master's in adapted kinesiology, and what adapted kinesiology is working with movement disorders with those that have neurological deficits, those with cerebral palsy, those with muscular dystrophy, and other types of dystonias, movement dysfunction, if you will. And that experience in my master's really kind of brought me thinking of how movement for that category of individual that are significantly affected by whatever neurological disease that they were dealing with, it really started to get me thinking of, gosh, like movement is what gets these people from point A to point B. And we as a therapist, and that's what I was acting as within my research, is working with these individuals in a pool environment, really teaching them how to literally feed themselves, the movement of feeding themselves, the movement of ambulating or moving from their bed to their kitchen table. Like it really became aware to me that what we were providing within that study and what I could provide as a therapist all revolved around movement. And so I was in this kind of paradox where I was like, okay, I finished my master's, I got this I was enlightened on the effect of movement on human beings, and I was like, well, what next? What can I really do? And so really the next direction was to go and get my PhD. And in that experience of my master's thesis, I was working with these individuals in movement therapy, but there was a chiropractor that I met that was working with a small cohort of my study group that was adjusting, manipulating their cervical spine. And uh, through the manipulation of their cervical spine, and there's only 3 or 4 of these individuals as part of my cohort, the chiropractor would adjust them, and these individuals would advance so much faster than the rest of my the rest of my subjects, the rest of the individuals that I was working with, because the adjustment would immediately change their tone of their tissue. Meaning that a lot of these individuals had tonic muscles, very tight tissues that would keep them in specific positions, and I was trying to get them through full range of motion. And the adjustment, this one movement of the upper cervical, these people would go from here and then they would completely relax. And so then I had this added time with these individuals to take them through movement, and they seemed to progress much faster. And I was like, this is fascinating. As a patient of chiropractic through the majority of my my sport career, I never had that aha moment. I had a chiropractor at our disposal. I played on some some high level teams, so we had a great rehab team. And the chiropractor would come in and just do their thing, and we're like, oh, that felt great, but we never had the aha like I did there. And so I started to dive deeper into what this chiropractic profession was, and what how I could leverage the practice of chiropractic to be able to help people move. And that's what I did. I found a school in Northern California, Palmer West. I got my degree program at Palmer West, and I practiced in Northern California for 12 years. I moved to Denver, Colorado, and got the opportunity to work with the great Dr. Jim Hoven at Project Move, where we attempted to integrate both, chiropractic and other manual therapies within a sport arena or sport training arena. And we learned a lot through that experience as well. And I still believe that that is the right thing to do, is to amalgamate movement therapists with movement professionals. So that was a great experience. And then now I'm living here in Austin, Texas, where I'm talking to you outside on my back deck. And so all of those experiences were also colored by my involvement with a company called RockTape, which, for those that don't know of it, it is a tape probably best known for its kinesiology tape, which is that colorful elastic tape that you're seeing on a lot of athletes, especially right now. We're going to see them in the next few weeks at the 2021 Olympics in Japan. And so I got introduced to an individual that was just a forward-thinking, entrepreneur, and he came to me with a product that could really help people move. And I had the idea of how to apply this product to be able to accomplish that task. And so we created this company called RockTape. And so over the last 11 years, we've evolved from not just being a tape company. We're really identified as a movement company. And that's what I'm most proud of, is that we have multiple tools to be able to help movement professionals, to be able to help people move from kinesiology tape to instrument assisted techniques, which are like self massage techniques, to multiple other products that just really help people move more effectively. So that's kind of like the evolution of Steve Capo through athlete to therapist to now educator.
Well, I'll tell you what, it has been an incredible journey. And I have to say, being on that journey with you, when RockTape was young, and when it was a baby company, I was with a baby company, Health Source, and the two of us grew up together. You and I grew up together, the companies grew up together. And so you were kind enough to kind of bring me in as part of the instructor team for RockTape. And I got a chance to teach the incredible principles of taping before it was a full-on movement company. The burgeoning of that was just happening, and the experience and the light bulbs that I saw turn on, like you said, that aha moment of the applying of tape to some of these practitioners, whether they be chiropractors, massage therapists, or acupuncturists. All these people were using tape, and it was changing lives. And man, again, I can't thank you enough for that opportunity, because it was one of the best of my life, of teaching all over with you, and the things that you taught me to teach others. Fantastic. But I would like you to take just a few minutes, because a lot of people that I come to, I still recommend tape for everybody. I do a lot of taping on the patients that I treat, whether they be the employees here at the law firm, family and friends that I still work on. Can you describe how the tape works in a basic way, so that people could understand it? Because I know they all see it, they want to understand it. Once they try it, they love it, but just giving them that nugget of what does it do?
Yeah. Again, it's something that I've kind of changed the story or evolved the story of delivery to be able to kind of make sense of something that is uh, that seemingly from the surface it looks like a colorful piece of tape stuck to your skin. So I can understand the hesitancy of a lot of people saying, well, you gotta better explain how that simple strip of tape on your skin is going to influence the specific things that people are looking for, which are, that tape help me experience less pain? Can that tape help manage swelling? And can that tape help me move more effectively? Those are the three categories that I probably would like to expand on. So that what the research is telling us and what we've been able to identify over the last decade that I've been working in this space is that the scientific community has received much more information to explain how a colorful strip of tape can actually affect pain, swelling, and movement. So let me kind of dissect each of those categories. This tape is not the traditional tape that many of the listeners in this podcast are going to be recognize, which is someone in turning 50 this coming year. I was raised on cotton athletic tape, that rigid tape that you would tape something to be able to support it or protect it, limit its range of motion while it's healing. So this form of tape, which is the category would be identified as kinesiology tape. I like to call it elastic therapeutic tape, which is elastic tape that stretches as similar to how the skin stretches over the body. So what this tape does, it's applied over an area of the body that's experiencing pain, swelling, and or some type of movement dysfunction. And what it really is interacting with is not the muscle, which is what most people believe, because you're trained to believe that I'm taping the rotator cuff muscles, I'm taping the hamstring, I'm taping the lower back muscles, and that's a kind of an old philosophy of thinking. What we're really taping, and what I think is going to be very clear once I say it, is that we're taping the skin, the organ, the largest organ of our body, which is the skin that overlies the entire body. We're interacting with the skin, and what makes the skin so interesting and how it influences pain, swelling, and movement is that it communicates where you are in space to the central governor, which is the brain. My watch is interested in my conversation as well. Um, so ultimately, you're taping the skin to be able to have a conversation with the brain, and the brain makes the decision. The brain really decides on how much pain you're going to experience. The brain can actually change certain physiological functions to be able to manage your movement, and the tape on your skin can also influence the swelling or the edema that exists in the area that might be injured. And so top level, tape is interacting with the skin. The skin communicates that information to the brain, and it can actually manage pain. It can manage your movement to be able to give you a better idea of where you are in space. And the tape on the skin can also create what's called a biomechanical lifting effect. Because it's elastic, it literally lifts the skin away from the underlying tissue, creating space. And that space can help improve what we call fluid dynamics, but improve the flow of fluid, both lymphatic fluid and blood flow, to be able to change the dynamics in that area. So that's kind of like my top level description. Tape the skin to influence pain, swelling, and movement.
By making sure the brain gets good input in and can give accurate input out to make the body work best.
I think that's and it's an important neuroscientific fact that I think once you explain it simply, because it's so, deep in respect of the neurology of what's happening, the skin, as I said, is it's communicating with the brain, and it does so by all these little these keys, like a key on the keys on the keyboard of a computer. Those, every time you press the key, that communicates to the central processing unit of the hard drive. The same thing happens in our body. We have those same type of keys that are communicating information from the skin to the central processing unit, our brains. And the information that we provide is critically important for the brain to be able to say, well, is this dangerous or not? Should I be experiencing pain? Is that a good thing for me to experience right now? Or, is this information that I'm getting, can I really decrease the danger signal and decrease the amount of pain you're experiencing? Pain is very unique to the individual, and it's all created in the brain. So if we can feed the brain with better information, strip a tape on the skin, we can change our perception of pain. So I think it's really fascinating what we're learning about this cross communication between the skin and the brain, and how a simple strip of tape can actually influence information to be able to change our experiences.
Well, and it has changed the experiences of millions, Capo. You know that we've seen it across every dynamic, from workers to Olympic athletes to pregnant moms. We've seen that, and it's so brilliant to see. And here's what I want to get into, because we have a lot of people that listen to the show that are business owners or that are managers and that kind of thing. One of the things I've always appreciated so much about you, and I'd like to dig into this just a little bit for a moment, is your creativity. Because before, like, I took the taping courses before RockTape was even around, right? With the original company that kind of Tim Brown had worked with, and this whole thing on kinesiotape. I took those, and the experience of what I got was very, very different, especially where RockTape, we'll call it 1.2 or 1.5, because 1.0 is kind of taping plus, and then the creativity and the outflow of innovation from you was mind-numbing to me, and it continues to this day. Can you go through your creative process? How do you look at things so that if someone's looking and says, man, I want to innovate in my industry or where I'm at, is there a process that you go through to how to take something and make it better that I and all the listeners could learn from?
I love how you put me on the spot. And you ask anyone that I guess is identified as creative or innovative in their industry, and I'm proud to have that label from people like you. And I again, it's difficult to explain, but let me just kind of bring it down to what I generally look for when I'm trying to come up with what could be another tool that could help someone move more effectively. What could be another message that I could deliver to that can improve someone's understanding? How I think through that process is generally looking for what I call the gaps, and the gaps are the gaps in understanding and gaps in instruments or tools or equipment that we can have within the industry. So let me give you an example on a gap in understanding. The gap in understanding when it comes to tape, for example, was that the general school of thought was that you're taping a muscle. And as I started to evaluate what the literature was telling us, it's pretty clear that we're not taping the muscle unless we literally cut the skin, peel it back all this connective tissue, and then we try to stick the tape on the muscle. And I'm making a joke of it, but that's really kind of like when I'm thinking of it, we're not taping the muscle, we're taping the individual. And so that's the gap, where the gap that I noticed is that people were thinking too mechanically. And I wanted to peel it back, if you will, and say, what you're really interacting with here is that I might even say it's the skin of the individual, but it's the individual that you're really interacting with. And that in itself is a divergence of thinking. And so when we deliver our education, we're having a different conversation. We're saying, I want you to use this strip of tape to influence the person attached to their condition, which could be a shoulder strain, for example. And just by approaching it with that um, line of thinking, completely changes the overall experience between the therapist and the individual that's experiencing pain or swelling or movement. And so that's kind of like how I approach most things, really, is looking for what's missing here. I know that tape's effective, but could it be more effective by changing the approach? And that's where I was saying that gap was that everyone else was thinking mechanically we're affecting a muscle, and I'm saying we're affecting the person. And that's probably the difference between how I think of it versus how someone else might think about uh, a similar type of intervention.
So would it be fair to say then that the reason you were able to see the gap was because you were trying to stay up to speed on the latest information? In other words, if you just learn what is and you just try to refine what is, you're taking baby steps. But when you're looking more comprehensively in a 360-degree angle, now all of a sudden, I think, from what I'm hearing you say, you're looking at the literature of how muscles move, how body moves, what does fascia play in this, what does the nerves do? You're looking at something that creates a larger gap to dive into than the mechanics. And the reason I ask that is because I think if we're looking at any problem or solution and looking for gaps in whatever industry we're in, what I just took from what you're saying is, man, are you studying? Are you trying to really involve yourself in what's going on around the macro of your issue, not the micro, therefore finding the gap? Would that be accurate, or am I going too deep here?
It actually clarifies, my line of thinking, and I might be losing my headset. Just please let me know if you lose my audio. But the idea of looking at something with a macro view, while still I dive into the micro understanding of the system that I'm working on. So the system that I have to know and know best, especially as an education influencer, is that I need to know the micro and I need to know it cold. So I'm consistently staying up to speed on what the micro information of the system that I'm working on, which is the human body. That's where my head is in literature on a daily basis. It was for the last 2 hours before this interview. But what I do is I try to take that micro information that the majority of people are leaning on and kind of focusing their attention on and saying, well, how does this apply to the macro aspect of my industry, which is, influencing the human being? So I love that way of approach that you have to know the micro, but you have to be able to see the global picture of what you're trying to influence. And this applies to multiple different industries, I'm sure. And I hope we can, this speaks to multiple people that are listening to this, but my industry is influencing the human being. And I just take a more macro view and then kind of figure out what components of the micro I can insert into that to be able to influence the whole.
That is awesome. I love that. Like literally, I can take that and use it. And I've got some specific things that I'm thinking of that I'm going to jump all over that when this call's over. So, moving through that, was there a challenge for you? I know for me, when I was treating patients, I had a busy practice. Then we had 5 practices. We're doing our thing, right? I'm really into that mode. When I moved out of that into more of the, whether it be leadership of other doctors or teaching or education, kind of that transition, was it hard for you? Because I know I had a little bit of reservation and guilt when I went through it, because some of my patients were saying, well, wait, you can't leave me. And you are such, Capo, you're such a great clinician. I mean, you're a fantastic educator. You're that whole package. Did you have any struggles making the jump from that? Because again, people may, in our world right now that are listening, they might be looking to change from whatever career they're doing to something else. And sometimes there's fear and sometimes there's excitement. How was that transition for you?
Difficult. I don't have to. I don't have to rest on thinking about that experience. It was significantly challenging because I felt that the guilt within me is that I wasn't serving my community, and it wasn't until, and you were part of this equation, but it wasn't until several people that I respected said, they had to give me the macro view. I was thinking, microscopically of my community was the patient base that I was treating for 15 of my 20-year career. So I had difficulty pulling myself out of that community and understanding that I was working on a more of a macro level of helping multiple other therapists, movement therapists, from chiropractors to physical therapists to occupational therapy, massage. I speak to a wide group of movement professionals, And it wasn't until someone said that you're serving a larger community with the information that you're providing to be able to arm these individuals to be able to help their respective communities. And that's what gave me solace to be able to say, this is the place that I should be in. And thankfully, I still get the opportunity to get my hands on people because I still have an active practice, nowhere near at the level that I used to, but I get to still treat people and still ingrain myself in the skill of that therapist to patient interaction.
That is beautiful. And again, being on that journey with you, it's fascinating to see how that goes. And at the same time, you and I both had to develop a sense of business. So if there's any providers listening, taking care of patients is one thing, and actually having a profitable business is another thing. And you and I went through that with Project Move, practices, everything. Describe how you now, because you're part of this, RockTape is a large company that is part of a larger company. On the business side, when you're thinking of that, when you're thinking of things, do you look at when you're developing a new curriculum for RockTape and whether one of the courses, we're going to talk about some of the courses here in just a moment, but when you're thinking about that, are you thinking on the business side, or do you say, hey, I'm the clinical guy, now I have business people, thankfully, that can handle that side? How do you divide your brain power?
Yeah, I'm always thinking about how the tools and education that we provide for the therapist, and I guess the entry level placement of these tools and education is to help the patients and clients that these people are working with. And obviously, these therapists, these movement professionals, rely on these patients uh, as it relates to their livelihood. This is what they charge for their services. They'll provide these people relief, and that's what they're looking for, the combination of both. They want to be able to help people, but they also want to sustain their practice financially. And so my initial view of creating these products are looking at how do they help someone physiologically, neurologically, and all the things that we just talked about. But then I quickly start to think, well, how does this benefit the business person within the therapist? And what I mean by that is, let's take an example of soft tissue therapy. When someone is working on someone with their hands, which is what chiropractic is, um, the one of the main uh, limitations for practice longevity is sustaining your own body to be able to deliver the therapy on someone else. And quite often, many people in my graduating class no longer practice because of orthopedic conditions that they've sustained through helping others. So when I'm thinking about a tool, I'm thinking of how does this tool potentially offload the stress on that individual to be able to allow them to practice longer. So to be able to realize the financial income of practicing for 20, 30 years, maybe more. So the example I would give here is that I came up with a tool that existed in the market, but we've innovated the tool to make it more fiscally sensitive, meaning that the price point was more appropriate to be able to allow more people to realize this in their practice. And the tool itself, as it's applied to the individual, takes the stress off of your body and applies it through this instrument. So to answer your question, I'm trying to split the uh, the need of the tool and the education to be able to help the person be more effective in treating the individual, but also to be able to allow them to do it longer by taking the stress off their body when applying it. So that's how I focus my attention on what I'm creating, is how I can help them in both facets of their industry.
That is so important because as providers, again, it is hard. It's harder work than people think if you're into the manual side of things, right? If you're doing whether it's chiropractic adjustments or soft tissue work, putting people through exercises, it does add up. So for you I love your term offload. For you to be able to offload the physical pressure also offloads that mental and emotional stress of your body starting to break down, wondering, am I going to do this anymore? So I can tell you from firsthand experience, Shauna, my wife, who, we're all very close, and she loves you. She told me to tell you a big hi and virtual hug, by the way.
Thank you.
She had to stop being a massage therapist and go to acupuncture school because of that very thing. She just got so busy and her hands broke down. And now with the assistance of things like you've provided with these tools, it's amazing longevity that people can get, and those providers can help more patients. And so along that line, can you share with us, Capo, some of the things that you've created within the RockTape universe that are designed to do that? So I was, again, fortunate enough to teach or take many of the courses, but that's been a couple of years. And so even then, besides taping, there was the cups, there was the kind of, the tomahawk type of stuff and all these other things that you've provided. Can you just give us a sense of what you're using on these tools to affect all of this brain-body connection that we talked about earlier?
Yeah. Well, again, the tape is probably best known, the company is probably best known for its tape, the kinesiology tape. So we have, different levels of tape, from wider and thinner tape to be able to appropriately affect different regions of the body. So that's kind of our core product and our core education delivery. But then I'll have a couple of other categories. The second category of tools to help people move more effectively are something that's considered instrument assisted soft tissue manipulation. It's a mouthful, I know, but IASTM is kind of the acronym. And ultimately, these are tools, typically stainless steel tools, to be able to apply a force to the tissue, again, starting off with the skin, to be able to manipulate the skin and the underlying connective tissue, fascia, muscles, ligaments, tendons. Again, all about communicating that information to the brain. At least that's our model of approach, of using it as a neurological tool, not as much as a scraping tool to break down tissue. We're talking about how we can communicate with the brain to be able to appreciate all the changes that we're looking for in respect to pain, swelling, and movement. So that's our second category, our instrument-assisted tools. We have different sizes and different shapes to be able to appropriately affect all different regions of the body. So we have the instrument-assisted tools. And then the next category would be what I consider myofascial tools, tools that are focused on addressing myofascial or muscle and tissue related issues. And those include myofascial cups. These are kind of what most people are familiar with as that traditional Chinese medicine, the cups that you would apply on the tissue that create suction, that allow for the therapist to be able to apply to the body part that's experiencing pain, swelling, or movement dysfunction. And then the last category the last tool within that category would be compressional floss bands. Difficult to explain verbally, but it's ultimately applying a wrap of a specific area of the body, let's say the knee, for example, with an elastic band that creates compression. And that compression, coupled with movement of the body part, has been shown to improve the mobility and function of that area of the body. So compressional floss band is a newer category of therapy that's been implemented over the last couple of years within our arsenal, and it's been showing some great outcomes. So those are the main categories: tape, instrument-assisted tools, and then myofascial tools.
Man, that is so great and powerful. And when I explain this to the patients that I'm treating, because I use all of those thanks to you, again, appreciate it so much. As I'm doing that, what I tell people is I say, listen, there's these receptors that talk to the brain, and they live in several places. They're really dense in the spine, and they're also dense in the joints of the different parts of the body, but they're also in the muscles and in the skin. And if I can get effect on joint, muscle, and skin through movement or through whatever apparatus, it's going to give the brain all this feedback and all this information so it can do the right thing. And I'm telling you, the combination of that it's just so powerful. So the fact that you were thoughtful enough to be able to put that all together, and this is where I'm going with the next part of this, you've been so willing to share it with people outside of quote unquote your discipline. And because your purpose, you as the innovator within that company and the kind of the director of all things education, that's your brainchild, is to be inclusive. And I love that because I know that about you as a person. You're incredibly inclusive with people of all sorts and different brands and sizes. But that's what you did, and you took that, and the company RockTape took that to the masses to say, we welcome you. Come on in, chiropractors, yeah, but come on in, medical doctors, come on in, physical therapists, come on in, acupuncturists. Come in if you're into movement or want to be. That's number one. But the second thing I just want to give you guys a huge kudos for is the amount of free education that's been provided to the general public. People want to know how to use these things, right? And everyone doesn't have access to a superstar provider that they can get all this help from. And so all of the videos on the RockTape website, I would guide people there all the time. Like, look, you can buy the tape, and then if I or another provider aren't close to you or there's none by you, just go to the website and it'll show you how to do that. And that has just been, to me, Capo, such a wonderful addition or a gift from the RockTape family to the world to let people see how they can use this incredible tool without having to pay for it. Was that intentional on your guys? Obviously it was intentional, but was that a big part of how you were going to get messaging out, or what was the thought behind that?
Yeah, we use this term open source quite often, and open source is generally considered that, the information that we're providing isn't a brainchild that I came up with on my own. I just came up with a different way of telling the story, but the majority of the information that I get to now repackage and deliver to a larger audience, I get from people like yourself and others that I've learned from. So open source is something that we've ingrained within our educational platform, meaning that the information that we get, we want to deliver to the masses. Now, we focus our attention on movement professionals because they have the greatest ability to be able to influence the community that they work with their skill set. But everyone has, within their lifetime, is going to experience pain, swelling, or movement dysfunction that is influencing their ability to live their lives the way that they want. So giving this information at a level that anyone can understand and apply is critically important to the brand and to our mission. So so that was intentional from the beginning. Open source requires that this information is open source to everyone.
That is beautiful. I have
Yeah.
one more question for you, my friend. With all you've done, you've traveled the world, you've shared this message, you're continuing to innovate, you're always doing something new. I would say that you're on the leading edge of so many things in healthcare. Is there one piece of advice that you've gotten or that you've learned along the way that has helped you achieve all the amazing things that you've achieved that you would like to pass on to the listener or the person viewing this podcast today?
Yeah. I was just reading this today that really, and being the tough hockey player, lacrosse player, and uh, the experiences that I've had, especially as a male, I don't quite often express the emotional side of myself. And lately, and this is even within my professional identity, I've been reading things that really kind of hit a chord. And I'm not sure if it's because I've hit midlife. I'm not sure if
Welcome to
accrued,
it.
yeah, I've accrued so much experiences that eventually it says it's going to bubble up to the surface. But I was reading something and it ultimately struck this chord that got me thinking, man, that's how I think, not just professionally, but idealistically. That's how I think, and it really is be and think human. So let me explain that in more detail. Professionally, the gap that I identified very early on is that I'm not working on someone's hamstring. They're coming to see me. Their hamstring is affecting their ability to express, something that they want to do. And I was the mechanic for many years, where I was taught and trained to work on that hamstring. So that's what I did. And then I realized through multiple experiences that I was partly effective, but not wholly effective. And it wasn't until I identified that I was working on a human being and I was a human being, working on another human being, that changed everything for me professionally. And as I've been working through myself personally, I, recognizing that I'm just a human being, trying to be a good human being, within other human beings in my community, it changed myself personally. So what I want to get at is that regardless of what industry you're working on, understand that you're trying to influence another human being that has the same type of experiences that you might have had, that you could use to be able to leverage a more substantial experience amongst both of you. So I would say, if you put me on the spot, what you did, and said what was the most profound influence on my career, um, I would say recognizing that we're working with human beings that require a more global view of the situation. So that's probably my best answer that I can give you.
Man, that was jaw dropping. That was I'm going, yeah. And it's so you, right? If you never realized that till recently, you've been exuding that since the day I met you. So it's been bubbling under there. And now you just had this epiphany with it. That is amazing.
Yeah,
So
right.
as we close, let me ask you this. If people want to learn more about you, about RockTape, the work RockTape is doing, some of the things, how they can get RockTape or some of these other tools, or find providers because they're hurting, what's the best way for them to connect with you on that level?
Well, the website is always a good starting point. So rocktape.com, we have, kind of a direction. Once you go to the website, it'll say, are you an individual that's looking for information for yourself, or are you a therapist that's looking for more information to help your patients or clients? And that can kind of direct you down the educational tree to kind of get more information. Part of that educational tree, as you referenced, is our free education that exists on the website, as well as which I have a 12-year-old daughter that basically is going through her educational experience via YouTube. So we have a YouTube page that you could look on that provides a lot of information in respect to all the tools that we have. And then individually, if you're on social media, I guess what I'm most active with is my Instagram, which is fascia doc, FASCIADOC, fascia doc. I'll quickly just explain. Fascia is the tissue that I've been diving into for the last decade, which is just below the skin, that has demonstrated to be a significant organ that can provide all the outcomes that we're looking for. So on that platform, I share a lot of information on this network of tissue called fascia that could potentially expand your understanding of human movement and human experience. So that link, or that Instagram channel, I provide most information on my professional identity, but then on the story, I share uh, something that hopefully will make someone smile. And so today, as a good example, is Canada Day. July 1st is the July 4th of the U.S. And so Canada Day is meaningful to me. And so today I shared a bunch of things that hopefully make a lot of Canadians smile, because it has a lot of internal, stories and memes that I think most Canadians could resonate with. So that's how I split my time: a little bit of smiling and a little bit of education on that Instagram channel, Fascia Doc.